Thank you for your willingness to participate in our study, as we hope our findings can be used to broaden the accessibility of neurology to clients, and also ease the burden traveling can bring on pets and owners alike, especially when they have a neurologic condition. Please understand that we do not require you to perform every aspect of this exam to be in the study, as we understand the time commitment could be difficult for a lot of owners. On the screen is an example of a partially submitted exam which includes only a video of the pet's seizures, the off-leash gait evaluation, a video of the pet eating, and the owner assessing knuckling on their pet. To start with, please watch the video on how to use PawNode if you would prefer to use the app. The link is in the description. Additionally, as a reminder, please only perform the parts you are comfortable with and that are safe for your pet. Do not attempt any part of this exam if your pet is overly painful, aggressive, or if movement risks further injury. Also, in terms of bladder health, if your pet cannot urinate on their own, do not apply pressure to the bladder unless specifically trained by a professional, as improper technique can cause a rupture. Now, let us start on recording the examination. As you can see on the screen, there are 5 sections, but again, not every section is going to be performed. Before viewing further, please understand that there will be animals on the screen having seizures or other fits. If that bothers you, or if you don't need to hear instructions on this because your pet does not have spontaneous episodes, please skip to the timestamp on the screen. To start with, here is an animal that is having a seizure. When recording a seizure or any fit, spell, syncopal event, tremor, or any spontaneous event, having the entire animal in view is helpful, along with having the animal in a well-lit room. You can also describe how long the events usually last, and you can also record any post-episode activity, as that could help us with our evaluation. If the room is too dark, it will be hard for us to evaluate the episode. Also notice there is additional information that could be provided about the episode, including how long it lasts, if this is normally how it looks, if there were abnormal behaviors before and after the event, if there is a time of day the event usually happens, how often the events happen, if there is a trigger for the event, and do they have other events that look different. The next part of the exam is determined by whether or not your pet can walk. If they are not able to walk, please skip to the timestamp on the screen. Otherwise, please watch the following section on recording your pet walking or their gait. When evaluating your pet's gait, ideally we want to capture their natural movement to start with. Please ensure you are testing them on a flat, non-slip surface such as concrete, grass, or carpet. Record your pet interacting with their environment off-leash for 1 to 2 minutes. As you watch the video, notice we are trying to record your pet from both the right and left side, in addition to them walking towards and away from you. Also try to capture them at a walk rather than a trot or a run. Additionally, if you can, keep recording if they take a bathroom break, as observing them urinate or defecate might be highly valuable for our team, but don't stress too much if you are not able to capture this. Like with spontaneous movements, the better the lighting, the better the video recording will be. If you are not able to record your pet off-leash, or if you are wanting to be more thorough in the exam, you can perform an on-leash walk. Using a harness or collar and a short leash, maximum of 4 feet, walk your pet at a slow, controlled pace. You will likely need a helper or a tripod for this part of the exam. The reason for this, as you can see in the video, we are trying to record your pet on the left and the right side, in addition to how well they turn around, and if possible, having them walk away from and towards the camera. These different camera angles will sometimes capture abnormalities which might be missed when only one camera angle is used. The final part of the exam is the obstacle test. For this, your pet can be on or off a leash, though it is usually easier to perform and record if they are on a leash and you have a helper. To perform this part of the exam, place a small safe obstacle on the ground like a broom handle, a folded yoga mat, or a pool noodle. Record your pet stepping over it so we can evaluate how they lift and place their legs. We ask that you record from both the left and the right side for the obstacle test, as you can see in the video, along with the pet walking away from and towards the camera. If your pet is not able to walk, this section is for them. Please skip to the timestamp on the screen if your pet is able to walk and you have already recorded the walking exam. Otherwise, please watch carefully, as this section will be difficult for some owners. The first part of the assisted exam is to examine your pet's alertness or mentation and their ability to right themselves. To start, try and have your pet lie on their side on a soft surface like a yoga mat or carpet. Please avoid hard concrete like what is shown in the video. If your dog is not able to walk, they could hurt themselves trying to get up on concrete or a hard, slick surface. Call their name or try to get them excited. We want to see if they attempt to sit or stand up on their own and record any voluntary movement in their limbs. Do this with them lying on both the left and the right side if possible. Also be sure to include the tail in the video so we can evaluate tail movement. The next portion of the assisted exam is the assisted walking portion. For small pets with only hind leg issues, place a sling or a rolled towel under their belly to support their rear end as seen in the video. Move them forward at a slow walking pace while recording from the left and right sides, and if possible while your pet is moving towards and away from the camera. Ideally, the pet should be on a surface with plenty of traction, unlike the slick wood floor shown in this video, as even some normal dogs will not move their legs if they are on a slick surface with a sling. For pets with issues in all four legs, if you have a harness to support the front and a sling for the back, gently assist them into a standing position and assist them forward, recording from one side, then the other side, and also moving them towards the camera for a front view and away from the camera for a rear view. If you don't have a harness, you can use a fitted t-shirt as shown in the video. Just ensure it is snug enough that they won't trip on it. Alternatively, you can support their chest with your hands, though this can be physically challenging depending on your dog's size and your physical capabilities. Thus it is worth noting if your pet is too large to safely lift, please do not risk injuring yourself or your pet. Skip the assisted walking entirely if this is the case. The next portion of the exam is evaluation of the head and face, and can be performed on all animals whether they can walk or not. Again, do not feel you need to do every portion of the exam, as this can be challenging for some owners and animals. First, we will start with scent and vision. Start by hiding a high-value treat in one of your closed hands without your pet seeing it, or under an object like a plastic cup. Present both closed hands or two cups, one with a treat and one without a treat, to your pet to see if they can sniff out the correct one. Once they do, hold the treat in front of them and slowly move it side to side and up and down to see if their head and eyes follow it. Try and get a good view of their eyes so we can evaluate how well the eyes move, and also move the treat close to the side of the chest for us to evaluate neck range of motion. If you suspect your pet has neck pain, please do not perform the range of motion part. The next part of the exam is evaluating how well your pet eats and drinks. Get a close-up, side-view recording of your pet eating a treat and/or drinking water. This helps us observe their jaw motion, tongue symmetry, and swallowing reflex. As you can see in the video, we are recording from the side again, evaluating how well the animal moves their jaw and how well they swallow. Although when eating we can assess tongue movement, it is much easier to see when drinking, as you can see in the videos. The next parts of the exam will involve more of a hands-on approach. We will start with a response known as the menace. To perform the menace response, move your hand quickly toward your pet's eye. Be sure to point your fingers forward to avoid sending a puff of air from your palm, which could fake a blink. We are looking to see if they blink naturally in response to the visual cue. Also make sure you are not touching your pet's whiskers, as this could cause a reflexive blink, rather than a behavior response, which is what we are assessing. After performing the menace response a few times in each eye, you can test your pet's palpebral reflex. To perform the palpebral reflex, gently tap the inside and outside corners of each eyelid to check for a blink response as shown in the video. Make sure you do not hit your pet's eye, as this could injure the cornea. Perform this a few times in each eye. The corner of the eye closer to the nose is generally more reliable to perform, but you can perform it in both corners if possible. The final part of the eye, when evaluating the eyes, is the most difficult portion. First, you will need to get your pet in a dim or dark room. This is to allow their eyes to dilate and for your camera phone to use the flash. Once in a dim or dark room, turn on your camera's recording flash so it stays continuously lit, or if that is not possible, turn it to auto. If the room is dark enough, the light will come on. If the room isn't dark enough, you will need to try another room that is darker. Once the camera light is on and the camera is recording, move the camera close to one eye to record the pupil constricting. If your camera is out of focus, tap on the screen so the camera will focus on the eye, then quickly transition over to the other eye for us to assess if the pupil constricted in the other eye. Give your pet a 10-second rest, then repeat the process, starting with the opposite eye this time. It might be hard for your camera to focus, and you might have to practice a few times, but as you can see in the video, it is possible to get a good focus on the pupil. The last section of the exam is also hands-on, but this time for the limbs and feet, as we will be assessing proprioception, tone, and reflexes. To start, the term proprioception simply means being aware of where your hands and feet are even if your eyes are closed. This is similar to a sobriety test shown in film and television, where a cop tells an individual to walk in a straight line or to touch their finger to their nose. Obviously, in pets we cannot ask them to do this, so we rely heavily on paw placement, often referred to as knuckling. Perform knuckling while your pet is standing, or while you support their weight with a sling. Gently flip one paw over so they are resting on their knuckles. Record how quickly they flip the paw back to a normal flat position. Repeat this for all of the limbs. Notice that I am positioning my hand under the pet, so they do not fall towards one side while I am lifting the limb. For the front limbs I support under the chest, and for the rear limbs I support under the stomach. If you are using a sling, make sure you do not lift your pet so high that they are no longer supporting their weight. Also make sure that your pet has good traction when this is performed, such as on carpet, a rug, or a yoga mat. Concrete could also work but is not ideal. Next is assessing limb tone and reflexes. With your pet relaxed and lying on their side, gently move their up legs, the legs resting on top, through a circular bicycle motion to feel for stiffness or limpness as shown in the video. After this is performed in each limb on that side, gently tickle or pinch the webbing between their toes on those same up legs to see if they pull the leg away from your pinch, as you can see in the video. For your safety, if your pet is sensitive about their paws and you feel they might try to bite, do not perform this toe pinch portion. The very last part of the exam is checking anal tone. Do not feel you need to do this, however, if you weren't able to record a bowel movement earlier, it is something to consider. To assess anal tone, lift your pet's tail, unless your pet is painful when lifting the tail, and gently touch the skin around the anus with a Q-tip as shown in the video. We are looking for a brief contraction, often called an anal wink. And that concludes our at-home neurological exam. Thank you so much for taking the time to complete these steps with your pet. Your participation is incredibly valuable in helping us make veterinary neurology more accessible for pets and families everywhere. If you have any questions or concerns about these steps, please reach out to our study team. Thank you again, and give your pet a well-deserved treat.